Hi, everyone. Dr. Paul here.
Hi. Hello, Doc.
Good afternoon, Dr. Paul.
Hello.
Hi. So let's begin. A lot I need to go over with you today. First, I'm just going to start by saying that we're up to. It's not on our website yet, but we're up to 31 cases. We are going to be now modifying our website over the weekend and into early next week to not only give the graphs that are there, but more demographics as we get more cases. I think it'll be important to tweak out age groups and source of infection and so on, and where they are, if they're hospitalized or not, or how many have resolved. So we're going to be putting that together over the weekend. Our staff are working to do that. Again, cases are from all over SDNG, Cornwall, and Prescott Russell. I just wanted today to spend some time on really some of the modeling that was done and sort of end up with some of the new measures that we'll be taking moving forward to enhance the current interventions that we're doing. And what I mean by intervention, I mean the public health measures that are being undertaken across Ontario, essentially across Canada. So, as many of you are aware, the provincial government released these the models today, and essentially, painted a grim picture of the situation that could have occurred had we not done any of the public health measures at this point in time. And so, I think that I want to go over them because I think they're very important. And what I've done is because the numbers don't lie, and this is kind of our goal. So this kind of sets our goals. So, for example, let's talk about the next month or so, and that's why I keep telling everybody, like, the next couple of weeks, moving into end of March into April is very, very important for us. If we look at the projection of Ontario, just the number of cases, just between now and the end of this month, if we hadn't done any intervention, there would have been 300,000 cases across Ontario. In our area, it would be around 4,500. Sort of just I'm doing a proportional amount. I believe that our area, in terms of complications, will be hit harder because we have a more vulnerable population. But currently, at this point, just staying with where we are, we've actually gone from the projection of 300,000 to about 80,000 in Ontario, and which means that we've already prevented over 200,000 cases provincially, and that translates into the prevention of about 3,300, 3,500 cases in the Eastern Ontario Health Unit, leaving us with, as of today, if we didn't do anything moving forward, we would have about 1,200 cases in our area. And if we extend our interventions, which I'll talk about a bit later, we're gonna go down to like 12,500 cases provincially, and in our area about a couple of hundred. One of the things that I think is more striking in my mind is if you look at the overall pandemic. So, for example, the whole duration of the pandemic, be it one wave, two wave, three waves, and nobody can predict if we're going to have them, but we know that this is going to linger on until at one point a lot of the population will be immune or we have a vaccine. So we're talking, over the course of the pandemic, which may be 6 months, a year, maybe it may go a lot longer, again, lingering. We're looking at, 100,000 potential deaths in Ontario, which is a tragedy. And if you extrapolate it to our area, just by straight mathematical, it's about 1,500 deaths just in our area over the course of the pandemic, and I'm worried that it would be more because of the vulnerable population that we have disproportionately in our area. The good news is, however, that if we do, with public health measures, we can bring that rate down significantly. Provincially, it's a wide range because it depends on situations, between 3,000 and 15,000, and locally we could bring it down to as low as 50 deaths. Now, 50 deaths too many, I know, but these viruses kill the elderly. They kill vulnerable people. So I wish I could say that we could bring that to zero, but unfortunately the reality is that there will be some deaths. But our goal now, I think we got it right in front of us. These are numbers now. We're dealing with numbers. You don't do this, you get so many deaths. You do this, you get these many deaths. Again, these are projections, but it makes sense, right? It brings it down to a reality. So if we're looking at deaths now over the next month, what can we do for the next month moving forward? Again, the projection is over the next just a month. There potentially, without any interventions, there could have been 6,000 deaths in Ontario and 90 to 100, if not more, in our area. But just by the fact that we've done the current interventions just up until this week, we're looking at going from 6,000 cases provincially to 1,600. Again, only talking 1 month now, right? And so bringing down the caseload in our area to 28, 30, something like that. And if we further our interventions, and I will talk about those scenarios later, we can bring them down to several hundred cases in Ontario and, 3, 4 in our area. So I think these numbers really show what could have been, what the actuality is, and what we can do even more to blunt that curve. So all these things, what I'm talking about now, is meant to flatten that curve, is to be able to plank that curve. And then there was another slide that actually looked at intensive care. There was a graph that showed if we didn't do anything, what the ICU load would be in the hospitals, how many patients in hospitals, and if we didn't, and then if the sort of the worst case scenario, and the best case scenario when we're working collectively, it's manageable, although it'll stretch our resources, it's quite manageable in terms of our ability to have an expansion capacity, adding extra beds and so on, provincially. So I think this is a very striking example of numbers that people can relate to, other than just a graph. This is what happens with this. This is what happens if you don't do this, and so on. So moving forward, one of the things that we're going to be doing provincially already today, you saw. I don't know if a lot of you have seen it. The provincial government, as of I think midnight tonight or tomorrow, I'm not sure when it will be, has now decreased that list of the workplaces that are exempt, that are considered essential. So the list is getting smaller. There will also be other measures that we'll be taking very, very aggressively in terms of our health unit. We've been working with what we call contact management and tracing. We've been asked to deploy most of our staff to that now. And what that means is, for every case that we have, there's sometimes 5, 10 contacts that we need to make sure we call them daily, make sure we follow them, make sure they self-isolate. So, if you're looking at, just for 30 cases, 150 individuals we have to track. So that's a lot of manpower that we need. But that's a very important thing, to remind them to stay home, to keep track on them, to ensure that they don't go out during their isolation period. And that's going to be one of our roles. The other thing that we're going to be looking at as well, and frankly we've been getting a lot of complaints, is still people are not adhering to the and in terms of another sort of potential moving forward step would be even diminishing the number of people that can gather to a couple. So again, those are future potential that can happen, all the way to curfews, all the way to sort of forced isolation of everybody and so on. Those are the extreme ends of the spectrum. But you could see where I'm going with this, because the more extreme we are, and the more cohesive our approach is, the more inclusive our approach is, the more we'll be able to blunt those numbers and bring them down significantly. Like I said, we won't be able to prevent every death, unfortunately, tragically, but we could, going down from for example, our area from 90 deaths potentially to a couple is much better than the 90 deaths. And again, even a couple of deaths is too many, but tragically, this is what happens with viruses, because they have a predilection for the most vulnerable in our situation. So now, what is the health unit going to be do about this? Again, locally, and you can see some other measures that are going to be put across the province eventually. But at the local level, there are two things that we're going to be doing. Number one, we've been getting complaints from for example, not all, but some retail stores, some stores, grocery stores, people, run around and they congregate and they don't follow the signs that are on the floor, and there's no crowd control, and people congregate in the parking lots and so on, and that shouldn't be happening. So there are so aside from putting on our website, some tips for shoppers how to safely shop and so on, in terms of following recommendations, washing your hands, all these things. I'm also going to issue a Section 22 order to all open retail, convenience stores, grocery stores that are seeing customers, ordering them to take measures to ensure that the crowd is controlled, that the infection prevention mechanisms are there, that people are there to ensure that there's no gathering, people distance, and so on. And that will be effective midnight tonight. The order is going to be going out very shortly with a press release associated with that. And the other order that I'm going to be doing is a Section 22, which Toronto has done as well. Again, because we don't want individuals infecting others. So, for example, people who are positive COVID and are put on isolation, or have a contact with a person and are put on isolation, or have symptoms of COVID, and even if we don't test them and ask them to isolate, they're going to isolate. We want them, that order will address them to actually enforce that they stay home, they don't go out, and there will be some penalties if we see that these individuals break that order. And that order too will be effective tonight at midnight. And that will be enforced by our own officers, public health inspectors and other enforcement officers, as well as we're supported by the police and bylaw officers. So I think that the point is that here we are right at the verge of being able to make even a bigger difference in terms of the number of cases and very importantly the number of people that will die. And so it's in our hands right now. This morning, I heard there was it was an actual improvement. About a month, I think a couple of weeks ago, there was a poll that polled people and said, "Are you following public health distancing?" And only 11% had said yes. And then this morning, Repeat said about 75% adhered to that. But there's a 25% that still need to really take this seriously. When you're talking about the magnitude of potential deaths, potential infections, potential hospitalizations, and such a simple thing to do. It sounds hard, but it's not complicated. Stay home, stay safe. Don't go out unless necessary. So we could do this collectively because we don't want the virus to circulate. We want the numbers to go down because then if you translate those numbers, they translate into less death and less hospitalizations. So that is my bottom line. That is the bottom line that we're doing, and that's why we're going to be issuing these. And again, there's going to be some more provincial implementation, perhaps furthering of the measures that I've described to you. But it's important. It's vitally important for us to really, really buckle down now because we're seeing the progress. In terms of some of those modeling, some of those numbers that we're seeing. We're seeing those curves. Those curves now is when that curve can actually blunt and flatten. And so we need to act collectively. And again, we need to ensure that individuals understand why we're doing it. And I think these numbers are, although, can be scary, but I want them to be used as motivation to be able to have a cohesive community approach, because after all, the majority of the individuals that we're trying to protect are our most vulnerable ones. And in the absence of a vaccine, in the absence of effective medication, it's the only way that we can create that protective halo around them. So that is again, I can't say that more, but I can't emphasize that more, but I can also tell you that we are putting a real impetus. We're speaking with our police officers, our community partners, our bylaw officers. We're all on the same page. We're going to be drastically, we're going to be looking around. We're not going to be, there's not going to be any pussyfooting. This is going to be, here we go. This is, if fines are needed to be given, they'll be given. Warnings will be given, but we will not accept now that people break these sort of recommendations, because now you know why you're doing it. Every time you go out, and you put somebody else, you expose somebody, or you spread the virus, you're actually putting those vulnerable individuals at risk. It's not worth it at all. One of the things that my colleague Dr. Donnelly said today, and I fully agree with him. A lot of people are saying, "My God, you're killing the economy. You're destroying the economy by doing this." But you know something? The studies have shown that the more you intervene aggressively, the quicker the economy will be able to bounce back. Imagine the tragedies and the number of casualties and hospitalizations and disruptions if this goes on for a long time, unchecked. So I think that obviously my main factor is we want to save lives, we want to protect our community, but at the same time we also want to be able to bring those numbers down and eventually move back to normal life so our economy can come back quicker, because a healthy economy equals healthy people as well. But for now, we need to understand why we're doing this. We're doing this to save lives. The quicker we do this, the better we do this, the more cohesive we are, the quicker we're going to get out and start going back to normal. I had a couple of questions here that were more they were more kind of like legal lawyer questions. If an employee has COVID or COVID-like symptoms, legally are they required to tell their employer? And so I'm not a lawyer, but I asked my lawyer, I asked some of our lawyers, and essentially there's the duty that an employee must inform their employer because they have to report any hazard which he or she knows. So an employee that potentially has COVID is a potential hazard to the others. The other part of that corollary was, let me see what the other question, the part was, are employers obligated to inform staff if there's been a positive case in the workplace? And that goes for anything, that goes for any hazard, yes. They're not obliged to tell them who it was, but they're obliged to tell them and take the necessary precautions. So those are the legal questions. I'm not a lawyer, but I had a quick email to my lawyer, to our labor lawyer, who gave me those answers. Is there anything else of an employer reports? No, it's basically that. So, yeah, legally they have to. So that's it for my update. Stay tuned for, like I said, a press release, and we'll post the both orders on the website. And I'll take a couple of questions now.
Dr. Paul. Phil Blanchard, Morrisburg Leader.
Yes.
Okay, so I've been doing some research on acute beds and so on. The numbers I received from a report from Critical Care Ontario showed the number, and this is a little bit of a dated report, so I'm hoping you can give me some better numbers on this, that the Cornwall Community Hospital is a level 3 hospital,
yeah,
and it has 12 critical care beds, 4 ventilator capable. And Winchester is a level 2 with only 4 that are BiPAP. When Alexandria and Hawkesbury do not have either, or they're not listed on either.
No.
So do you have better numbers than these on what our capabilities are right now?
I can tell you that those numbers can. I don't have exact numbers, but I was on the phone yesterday with the CEO of the Cornwall Hospital, and I can tell you that there is a right now that's the current capacity, but there is are plans in place for expansion of their ICU and increasing ventilatory capacity at both, mostly at the Cornwall Hospital, because that's a level 3, whereas in Winchester there is capacity to vent a couple of patients as well, but there is increased capacity for, as a matter of fact, there is also plans actually there for a COVID ICU at the Cornwall Hospital as well. So they do have capacity to increase. I don't have the exact numbers. I was on the phone yesterday and today with both the CEOs, asking them exactly that. And so at this point, there is capacity, and there are plans as well if we require more ICU or more ventilator space. There are secondary units that can be used for that as well. So at this point, the hospital's not overwhelmed, but we're preparing for a worst case scenario.
Okay.
Dr. Paul, it's James Morgan here from the Review, and I just wondered questions about testing. Do the results that show positives also indicate immunity?
Good question. Theoretically, and I have no reason to believe that this virus will be different. Theoretically, if an individual has been infected by something, it's as if they've been vaccinated against that. It's like their body creates antibodies that usually last for a couple of years, if not longer, and then the next time they see that particular strain, their memory antibodies pop up right away and kill the virus. So, yes, technically we think that an individual, just like any other virus, if you're exposed to that certain strain, that next time you're exposed to that, you'd be immune.
Now, in that case, so that could mean that there's people walking around who are asymptomatic. Is there any consideration of testing everyone eventually?
That's been bandied around. That's been right now. We do have a possibility to test. It is a bit more complicated than it's a blood test. It's not a nasal swab. But that's something that we're going to be considering, either doing random testing or, sort of testing individuals. When you happen to test them for something else, you might do the test. So those are things that we can be doing to give us an idea of what percentage of the population has been infected and by sort of extension is immune. As a matter of fact, what they're doing now, some studies, some experimental approaches, is that they're actually taking individuals who have recovered from COVID, taking their blood and extracting the gamma globulin, the antibodies, the serum, and actually using that to treat patients, believe it or not. That's kind of the old way that we used to treat certain individuals with infectious diseases. You take a pool of serum from people who already had the infection, and you inject those antibodies, so to speak, into that individual. So, yeah, that is a reality that will eventually occur.
Dr. Bill, Cornwall News Watch.
Bill?
Real quickly.
Cornwall Mayor Bernadette Clement was
22 order for grocery stores.
Hold on, I got two. Let's go to Bill first, then we'll go to the second one. Bill, what are you saying?
Yeah, I was going to say, Mayor Bernadette Clement was speaking last night online, and she said, quoting here, "I felt like business as usual in terms of levels of traffic on my way to City Hall. I'm not satisfied with that. It makes me nervous, very nervous." And now you mentioned something about rejigging how you're going to be reporting stats. But do you think that people aren't hearing about Cornwall cases? All they hear, or before you took the locations away, all they were hearing was SD&G, that people are complacent. Do you think that the health unit is somewhat complicit in not actually stating that there are cases in Cornwall, or making that more apparent?
We had said there are cases in Cornwall. We had initially said, and I've said it time and time again, we've got cases in Cornwall, we've got cases all over SD&G, we've got cases all over Prescott-Russell. I mean, the point is, and I know the mayor has spoken to me about that, we will be doing some more outreach and telling people, but I think that whether it's in Cornwall, whether it's in Winchester, whether it's outside of Cornwall, in Somerstown, it to me is the same thing, because for every case that we've tested, there may be a couple that we haven't tested yet. So that's why, and the thing is that's why we've said it. I've said it. I've gone on record that we have cases from Cornwall, we have cases from all over SD&G, we have cases from all over Prescott-Russell. So I'm talking about the whole area here, and hopefully, the message will get across.
Okay,
thank you.
Dr. Paul, Nick Seabrook, Cornwall COA News. I wanted to ask you, who will be responsible to enforce your Section 22 order for grocery stores?
There's a whole slew of potential. We have our public health inspectors. We have our other enforcement officers, our tobacco enforcement officers. All of our provincial offense officers can do it. We're working with municipalities. We're working with the police as well. So there is maneuverability in my order to ask for help for enforcement. So we're going to be having a collective approach to this.
All right, thank you.
Thank you.
Dr. Paul, Nelson Zambergen, Nation Valley News. Can you say how many people have gone through to be tested in Winchester?
Yesterday, I think the numbers were they just started. They had about 25 or 30 yesterday that came by. Most of them got tested. Charlie told me, but I don't remember. I wrote it down somewhere, but it's in that range.
And just to follow up, somebody who goes through the doors of one of these testing centers because and either they go out the back door because they're rejected and not eligible, or they get tested. In either case, they basically get an order telling them they have to stay home for 14 days. There's no stopping off at the grocery store if you decide to go through the doors of one of these things.
Well, the thing is, if you got symptoms, then you got to go straight home, whether we test you or not.
Right.
And that's what my order is going to be as well.
Okay. Thank you.
Thank you. All right, everybody, that's it. I've got to go and issue that order now, and stay tuned for the press release. It'll come out shortly.
Okay,
Thank you.
Have a good weekend.
Dr. Paul, merci.
Bye-bye.
The leader has left.